Hi, I'm Dr. Tessah Lim. I'm a board-certified dermatologist practicing here in the province of La Union, and this topic is about skincare in your 30s as requested by one of my subscribers. So, in your 30s, you will notice some things that are different in your skin. So, number one, you will notice that there are more hyperpigmentation in your skin, or we call those sunspots. Your wrinkles may be more prominent or more noticeable, and sometimes you can also notice the skin can be also dry and sometimes even acne prone. So because of this, you should be more careful in what you apply to your skin, and sometimes you have to apply more products because your skin has aged. So here are my tips for you, and I hope you enjoy the video. There are three things that I want to emphasize. Number one is sun protection. I cannot emphasize how important sun protection is because the main cause of your skin aging is the sun, specifically UVA, which causes the skin to age. At the same time, UVB can also contribute to it because when your skin burns, then collagen breaks down. Okay, so when you turn 30s, the collagen production also slows down. So at the same time, because it slows down, then you need to apply certain products to your skin, even do procedures to somehow slow down the breakdown of collagen. So aside from that, you should also start to apply antioxidants. Antioxidants can help your skin, especially if you have fine lines, wrinkles, or hyperpigmentation. Retinol, in the other hand, is the best product to not only prevent wrinkles, they can also treat hyperpigmentation, and they can also form collagen. So it's a wonderful product that you should be starting at this time. So again, and as we age, during your 30s, sometimes it takes longer for your skin to slough off. So when you're young, mabilis yan eh. The turnover is just great. Sobrang bilis. But when you age, medyo slow na. That's why you notice that your skin can be dull. Parang hindi na siya kasing glowing as when you were younger. So this is when the alpha hydroxy acids, the acids help your skin because it sort of helps your skin to remove the dead skin, and then what you will notice is you have brighter, beautiful skin. So what are the alpha hydroxy acid? Could come as a cream, as a lotion. Sometimes you can add it as a wash in your regimen, or you could do chemical peels. Chemical peels are usually done in the clinic of the dermatologist. You could do it once a month, once in 2 months. It really depends on how often you want to have it done. You have to consult with your doctor. At least once a year is really great. It will help your skin immensely. Another point that I want to emphasize is that some of the patients that I've met, they tend to just use the products that they've been using in their teenage, when they were very young, or in their 20s. Our skin changes. So as we age, iba rin yung nagiging needs ng skin. So we should be able to be open to changing the products that we are using as we age. So for example, you gave birth, diba? Your skin tends to be very dry after you give birth, especially if you're breastfeeding, because of the hormones that plays a big role on why the skin has changed. So because of this, you have to be able to change the products that you're using for yourself as well. That's the same concept as we age. So may mga products na nag-work sa'yo when you were younger. When you were younger, you had oily skin, acne-prone skin, and now that you're in your 30s, baka hindi na siya okay for your skin, because in your 30s, you may notice na your skin may be dry. You may notice na your skin may be showing more signs of aging, like hyperpigmentation or fine lines, which need to be treated by other medications or other products. So there. Some patients, they tend to buy a lot of products. Like they want to get 10 products. This like 10 steps of skincare routine ganyan that they saw on YouTube or they saw on on TikTok, ganyan. More than applying a lot of products, it can be helpful to use, like, to do preventive Botox. Neurotoxins can help, especially at this time when wrinkles are being more noticeable. And number two, you could also invest in like a laser procedure. Lasers can also be helpful to for your skin, not just only for hyperpigmentation. Can also help you so that it can tighten it, and so forth. So microneedling is also a wonderful procedure you can consider because it can also promote collagen production for your skin. So in your 30s, you should have to be using a good sunscreen. Not all sunscreen are created equal, so you should choose your sunscreen very well. And I try to change my sunscreen ever so often. Or basically, nasasawa din kasi yung balat mo. So I try to change it. So this type of sunscreen, it says it's a mineral sunscreen. Okay, so like that. So it's a mineral sunscreen, and it says it's broad spectrum, and it's 100 mineral based. And kapag mineral based, it's not irritating. So ano lang siya, light lang siya sa skin. It doesn't cause, hindi siya mahapdi. There are certain sunscreens that when you use, it feels like parang, alam mo yun, mahapdi siya sa balat. Usually those are the chemical sunscreen. The mineral ones, hindi yan mahapdi. Here's the first one. Okay, what other sunscreen do I have? This one is another mineral sunscreen. There. So, for the mineral sunscreen, this type, it says it's UVB, UVA, no whitening effect. The problem with certain sunscreen, kapag medyo mataas na yung SPF niya, medyo may white cast na siya. So, selling point if you get a sunscreen with a higher SPF which doesn't leave that white cast. So when you take a photo, minsan ang pangit, diba? Nagre-reflect, para kang mukhang ghost. So there, this is mineral. What else? It also says it's water resistant. I'm not sure. I can't read the small letters, but it's also nice to get one that's water resistant. Ibig sabihin, pag nabasa ka, if you use it when you're at the beach or whatever, hindi siya agad mahuhulas. I know this product, ano siya, meron daw siyang retinol. I can't find the box, but the medical representative told me it does. So currently I'm using this one, but I keep changing. I tell you, I change my sunscreen like every month. And I tend to use a lot. I use 2 finger length full just for my upper face. Yung super init dito sa La Union, I tend to use more. I also use like 1 or 2 finger length full for my neck alone. Kasi we cannot protect our neck enough. Sometimes yun yung napapabayaan. Like, ang ganda ng face, pero yung neck magsisag or may lines. So, yun. One of my tips then is don't forget to apply them on your neck. This is the sunscreen. There's also this sunscreen that super tagal na to. I don't use it now. But, for this one, it says, is this the tinted? I'm not sure. Sometimes there's certain sunscreen that says it's tinted. So, that's really nice for melasma, for hyperpigmentation. If you find a sunscreen that's tinted, usually meron yung shade eh. So, for this one, I think may shade siya. Kasi parang siyang makeup type, ganon. So, when it has like sort of like a color, like a tint, it can also help for melasma. So, that type of sunscreen is really good. For the actives, the minimum active that I recommend is a vitamin C. So, this is not oral vitamin C. Still, patients tell me, Doctora, nag-oral vitamin C ako, it's different. This is topical vitamin C. There are 2 types. I'm not sure if this is still the packaging. I just have this as a shelf. It's really an old one na. There's like a topical vitamin C and there's like concentrations. I think this is an old one na. Hindi na ito yung packaging nila. This is 10% vitamin C. 10%. Yeah. Has no concentration. It's like a lower type of vitamin C. Ano lang siya. Vitamin C lang yung nakalagay. But for this one, it contains ferulic acid pa. Ferulic. So, aside from the vitamin C, it has ferulic, which is another antioxidant. So together, they're really great. Before there was a different product like the skin cuticles. It's vitamin C plus ferulic is marvelous. Maganda talaga yung vitamin C na yun. They don't, there's no more parang supplier of that one now here in the Philippines. So, ito na muna yung ginagamit. Available from dermatologists. I know there's a lot. But for the vitamin C serum, like for the Obagi, marami silang concentrations, like 10, 15, so forth. Don't get the higher ones kasi mag-irritate yung skin mo. If it's going to be your first time applying vitamin C serum, medyo warm siya sa skin, and if you use the higher concentration, it might cause irritation. You won't enjoy applying it. So, just start low, and then you put it in the refrigerator. Lagay mo siya sa ref para hindi siya agad na mag-oxidize. Vitamin C that oxidizes color yellow na. Maybe this other one na meron ako, super old na to eh. Just put it there sa shelf. Iwan ko na siya, dapat itatapon ko na to eh. I think this one has oxidized na. I will show you how it looks. It looks like brown na siya na liquid. So, when the vitamin C is oxidized, when it's brown liquid, hindi na siya effective. So, basically, useless na yung vitamin C. So, if your derma cells, if yung derma mo, or if you buy like this, ito, this is oxidized. It's super dark. So, basically, useless na yung vitamin C mo. Kasi super dark na siya. It should be like a light yellow color. So, this one is super dark. So, it's, you can throw it away. Next, what other actives? There's another active here, which I don't use. It was just recommended to me. But it was too irritating for me because I've been using certain products also. Siguro nagka-counteract siya. So, this one contains tranexamic acid, tyrosinase control complex, and niacinamide. Okay. So, this is another example of an active. For the moisturizer, you can choose your moisturizer. This one is also given to me. This is Indocare. There are different kinds of moisturizer you can use. It could be in a gel and a cream. It also depends. So you should apply it right after you apply like products that are irritating for your skin. Then lastly, the next product I will show is for procedure. So you can go to the clinic of your dermatologist. They could recommend a chemical peel. There are different types of chemical peel. This one is for hyperpigmentation. It's melanostop tranexamic acid. I have so many of these different types of peels depending on your skin type. There's a higher form. This one is glycolic acid. This was given to me free now. It's also for chemical peel, but only to be done by a dermatologist. So these are the things that you could consider for your skin. Thank you for watching my video. I hope you liked the topic for today. Please hit the notification bell, subscribe to my channel, and comment down below if you want to have certain videos posted, like certain topics, or if you have any questions. And I hope to see